Hospitals in Sussex have been under intense pressure in recent weeks, and despite putting in a number of measures to deal with this, NHS bosses say they are struggling with the number of patients who need to be admitted, and they're urging more people to speak to their GP practice first. John Young reports.
It was 1 in, 1 out at Brighton's main accident and emergency unit this morning. Inside, patients recently asked to wait far longer than staff would like them to. Across Sussex, it's up by a third on last year. One man told me he'd gone to A&E today because he was in too much pain. He had seen his GP weeks ago, but felt he couldn't wait for the consultant appointment any longer.
It's just too long. I've had to come up here myself, so...
And that's because you've been told to, or because you've not wanted to wait for
I've just done it off my own back, because I can't afford to wait that long. It's just, I'm in too much pain.
The chief nurse here was today stressing that accident and emergency was for accidents and emergencies.
A significant amount of people are doing the right thing and going along to their GP as and when they can.
Are enough people doing that?
It's difficult for me to say that. What I'm seeing here is a very, very busy department with lots of patients needing care. So it's difficult for me to be the judge on that, but I know that we are intensely busy at this time.
That's why in Brighton, the local celebrity Zoe Ball has recently spearheaded a campaign to remind people of the alternatives.
By using services out of hospital for conditions that aren't life-threatening, you can save A&E for saving lives.
For the NHS bosses, it's a hard sell.
You can get hold of a GP 24 hours a day, 365 days.
Many people will tell us you simply can't get hold of a GP when you need them.
And I think that's because there's confusion. The out-of-hours service doesn't have a very high profile.
Hence a recent poster campaign to raise the profile of options like these, including a walk-in clinic open 8 till 8 just by the city station. Meanwhile, the MP for Eastbourne was this afternoon demanding explanations after long queues at the A&E unit there.
Now, I was contacted by constituents who said it was closed. The hospital senior management said it wasn't, it was just severely stretched. I don't know the truth of it, but I'm determined to get to the truth for the people of Eastbourne.
It has not been an easy day to be an NHS patient or an NHS manager.
Well, John Young is live for us in Brighton now. John, you've been having a meeting with 2 senior NHS managers today.
That's right, and one of them, Polly, made quite an admission. I think it was Krista Beasley, you saw her in my news report there, in charge of the bit of the NHS here that coordinates GP services and encourages people not to go to A&E but to go to GP services. She said it's just too complicated. We're not getting our message across effectively, telling people about, for example, the 111 service that you heard in Mark referring to there. She said that she and her team have been in Brighton handing out these little wallet-sized information cards about where you can get GP and treatment, but said that half the people didn't even know about them. An admission there that the NHS managers have things to do, and it's not just necessarily the fault of the public.
Thanks, John.
Well, let's take a quick look at the figures. As we know, A&E departments across the country have had their worst performance in